Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First step, reminder of the reporting deadline for CMS quality reporting programs. NHSN encourages facilities to enter data in a timely manner ahead of the prescribed deadlines to ensure data completion and accuracy. Data entered into NHSN after the submission deadlines are not sent to CMS and will not be used in the CMS Pay for Reporting or Pay for Performance programs. Data must be entered into NHSN by February 15, 2024. Long-term acute care facilities participating in the Quality Reporting Program need to report central line-associated blood infections, catheter-associated UTIs, and C. diff, along with COVID-19 vaccination coverage among HCPs. Find more information about this at cdc.gov. Next up, policymakers and providers must take steps to prevent staff mass turnover, researchers say. Employment levels in SNFs are lagging compared with other parts of the healthcare continuum. Factors such as burnout lead to healthcare workers leaving during and after the pandemic. Employment levels have been offset by some degree by the hiring of agency staff, which may affect resident care by disrupting the continuity of care. And the use of agency staff places financial strain on providers, who must devote more resources to recruiting and training. Increasing evidence suggested staff dissatisfaction and staff turnover in healthcare settings can have unfavorable implications for patient care even without staffing shortages. Policy efforts to address healthcare worker burnout and improve healthcare worker hiring pipelines are well warranted. For more information on this, visit mcknightsliving.com. Next up is LTC Insurance paid out $14 billion in claims last year. LTC claims are on the rise. Insurers paid out a record $14 billion in 2023. In 2020, by comparison, $11.6 billion in claims were paid out. The number of claims paid each year continues to grow as more policyholders age into needing LTC care. The youngest baby boomers are turning 60 this year, with the oldest in their late 70s. Individuals are paying up to 27% less for linked benefit LTC insurance coverage, policies linked with another type of policy, such as life insurance, than they were a year ago. For more information, visit mcknightseniorliving.com. And last but not least, potassium-enriched salt is the missing ingredient in hypertension guidelines. A call to include recommendations on low-sodium potassium-enriched salt in hypertension treatment guidelines has been made by the American Heart Association. High levels of sodium intake and low levels of potassium intake are linked to hypertension and a greater risk of stroke and heart disease. Using a salt substitute where part of the sodium chloride is replaced with potassium chloride addresses both problems at once. It's time to include salt substitutes in treatment guidelines to help address spiraling rates of uncontrolled hypertension around the world and reduce preventable death. The number of people living with hypertension doubled in the past 30 years to about 1.3 billion people, as hypertension kills more than 10 million people every year, almost 20 people every minute. We must prioritize availability and accessibility of low-sodium, potassium-enriched salts as the new default. If the world switched from using regular salt to potassium-enriched, it would prevent millions of cardiovascular events every year at a very low cost. Find more information about this at eurekalert.org. Thanks for joining me for News This Week in Nursing Homes. And remember, for all of your LTC needs, call the Q.